Okay, we're back with Dr. Nicole Nguyen talking about HPV. It's an epidemic. It causes a lot of cancers, is life-threatening, and 80% of the population have either had it or have it now. So we're going to find out what we can do if you have the live virus, if you get tested and you have it. There's no cure, but there are things you should do. What are they?
So the best way to try to get rid of it is to keep your immune system healthy. So you want to be just healthy diet. You want to limit your stress as much as possible. Everybody laughs when I tell them that because everybody's all stressed out. Yeah. But that is a big thing too. So decrease stress, yoga, things like that, just trying to relax more. Mm-hmm. I also recommend that they avoid any smoke or secondhand smoke because smoking tobacco is like pouring gasoline on the HPV virus and cervical cancer. It's just like lighting a flame.
Wow.
So, and also I tell them to take a great antioxidant vitamin or supplements such as resveratrol or the other supplements that are available out there. So that helps too. Anything to boost your immune system.
Sleep, getting 8 hours of sleep, 7 to 8 hours sleep, because that's when your body replenishes cells.
Correct, yeah.
Replenish.
Something I never do.
Yeah, you don't, because you're delivering babies all night long. And then, folks, there is a vaccine, but the vaccine, let's break that down. The vaccine isn't a cure for all the different strains. Remember, there's over 150 strains of HPV. What is the vaccine for? Which one?
So basically, we don't really consider it a cure, but in all the studies so far, it has prevented cervical cancer in all the people who've received the vaccine. Nobody's developed cervical cancer yet. Now, it also does not prevent all infections with HPV. So
does it prevent throat cancer or anal cancer?
So far in all the studies, yes. So there's 2 vaccines available out there. The first one's Gardasil. That one covers 4 types of HPV. It covers
4 out of 150.
Correct, yeah.
Wow.
But it may help with fighting off the other types as well. So even though they're not directed at those types specifically, they may help to fight it off and boost your immune system to help you fight it off yourself. So,
fight it off.
Yeah.
But once you've been exposed, it does nothing.
Yes, it will help you to fight it. Yeah,
really?
so even if you got the vaccine and you get exposed to it, and even if you do get an infection with it or one of the other types of HPV, it'll help your body mount that immune response to
But if you've already been
rid
exposed and you get the shot, it does nothing?
Well, it may also help to clear that too.
Okay. So going back, what do they recommend? Because before it was like, get your teenage daughters, and they weren't doing boys. If boys are the vectors, I'm like, why aren't they doing boys? But now they are,
Now they are, yes. So Gardasil is approved for males too.
Okay.
They usually recommend getting it between the ages of 12 and 19, so before they become sexually active, ideally.
And we had talked before, if all the boys have gotten inoculated, then we could kill this virus.
Right.
Because
they've
boys
already
are the
seen
vectors,
a dramatic reduction in HPV infection and abnormal PAPs based on the results of the studies from the vaccine trials.
Now the girls, you said as early as 9 years old.
Yes.
So I have a 9-year-old, and I need to get her in because you want the body to build up an immunity to it.
Right.
And you need years to do that.
Correct. And the earlier they get it, it seems the better the immune response to the vaccine. So women over age 26, like say a woman in their 40s, they don't develop as good of an immune response when they get this vaccine as somebody in their teens. So.
But here's the funny thing. They are saying that don't even offer it to girls over 25 or 30. What is it?
Well, 26 is the cutoff where they recommend, and the insurance will cover it.
Because of the insurance thing. But guess what? You still have 20% of the population who haven't been exposed. I think that's bullcrap. How much is it? $500?
It's about $200 a shot, and it's a 3 series, so about $600.
$600 is worth spending and not getting cancer. Screw insurance. Just get the shots. Everybody, just get the shots. Just do it. $600 for your life is worth it.
Right.
Insurance makes me mad because then what happens is they tell the doctors to tell the patients, oh, well, you've probably been exposed and you're too old, it doesn't work. But guess what? There's a good chance you haven't been exposed. Get the shot. Get the shot.
No, I agree. I think it's good to do. If the only problem is you do a lot of times have to pay for it yourself because the insurance won't cover it.
Who cares? Aren't you worth it? Would you rather get a shot, do something, protect yourself and get a new stereo or new outfits? I don't know. I think invest in yourself.
I agree.
And that's what it's about. And other than that, be a monk. Abstinence. Abstinence, yeah. I'm kind of a fan. I'm a fan. Thank you so much for coming on.
Sure.
Thank you. News you can use.